So I'm here today with Robert. Robert has a very interesting story to tell that I think you're all going to get a lot out of, especially because we're going to be dealing with a very popular drug that is used to lower cholesterol levels. It's called Repatha. And Repatha is an injectable medication that lowers cholesterol and bad cholesterol. Robert, you would be a very good person to discuss what we're going to talk about today, because you are a physician and you're also an athlete as well. You're a runner and you've tried this medication. You've also had this very strange side effect. So, Robert, you got a fascinating story to tell. And so let me just cut to the chase. Robert, tell people about your experiences with Repatha, which if people are not familiar with it, you're a physician, you could probably talk about more expertly than I am. As I understand it, Repatha is not a statin drug like most people are aware of. It actually it's an antibody. It's what they call a monoclonal antibody, and it knocks out an enzyme or protein, I should say, called PCSK9, and that's something that many people have not probably heard of. But it's a protein that essentially makes us not use cholesterol and processed cholesterol so well. So by knocking out this PCSK9 protein, you can lower cholesterol levels even better than you could with a statin. Did I basically summarize that really well?
Well, Joe, first I want to thank you very much for inviting me on your show, your podcast today, and I am excited to share my story. First of all, I'm a 60-year-old male, obviously. I'm a retired podiatrist. I practice over 20 years, 25 years in the New York metropolitan area. And I got into podiatry because I was a college runner. And at one time I was somewhat of an elite college runner because I ran 10 marathons in the early 1980s. A bunch of Bostons in New York with the best time of 2 hours and 35 minutes in the Boston Marathon and 2 hours and 38 minutes in the New York City Marathon. Basically, what happened is this. I have a history of running. I never smoked a cigarette in my life. Never had any real issues, what I would think would be with a heart issue. I said, oh my God, I'm running. I could run marathons. There's nothing. The last thing in my mind was a heart. Well, lo and behold, back in December of last year, I had run a half marathon and I started bleeding out of my mouth. And I started to get upset and said, what's going on here? As it turns out, I had COVID. Now, I'm going to tell you a fascinating story, everybody, that COVID actually saved my life. Because when I started to bleed, I went to a pulmonologist who basically checked me, and he said, I've seen patients like you that have, damaged their lining in their lungs. It will repair itself, but let's just get a CAT scan just to make sure there's nothing major going on. We took the CAT scan, normal lungs, but lo and behold, on the CAT scan, it came up coronary plaque. So I said, coronary plaque? What are you talking about here? He said, you better go talk to your doctor or a cardiologist. So I went to my doctor, who happens to be a cardiologist, and he said to me, when was the last time you had a stress test? I go, I don't know. I run a marathon. I run 2 marathons a year. I mean, that's probably as close to a stress test as it can be. He goes, no. I want to put you on a treadmill and, we'll do a nuclear test and see what's going on. So I get on this treadmill and they inject some dye into me and I run for 15 minutes on this treadmill. It's 6 minutes and 30 seconds a mile. And the nurse said to me, okay, you can stop. We've got what we need. Doctor calls up. He says, you failed. I go, I failed. He goes, yeah, you went into ischemia. You got some kind of blockage going on here. So I had a calcium test taken. It turns out that I had a high calcium score of over 800. And then, which is very high, I should be around 0, okay? So they saw in the nuclear test and on this particular CAT scan that the LAD, the widowmaker artery, was 70% blocked, with a circumflex artery, which comes off the LAD, 60% blocked. So I talked to my cardiologist, wait a minute, am I going to need like a bypass now? I have no symptoms. I was no angina, nothing. It only came up in a treadmill test that the heart muscle, the EKG was showing some funky rhythms when my pulses got over 160. So he says, no, you probably, they'll go in there. If you need stents, they'll put stents. So I go in, interventional cardiologist in Manhattan, does the work. And I told him my history, and he, as I'm up during the whole time, and when we're done, he says, oh, by the way, without really researching this, which is part of my issue internally, he said, well, yeah, you had the one that we thought was 60% blocked was only 10 to 20% blocked, so we're good there. But the other one was 70% blocked. So I had to put 3 stents in. I go, what? You put 3 stents in? And, I was very upset because I said, wait a minute. I never had any symptoms. I'm an athlete. And now I got 3 stents on my heart, not knowing what it entails. Because going forward, he said to me, well, you go back to your doctor, your cardiologist, and you're going to be now on a blood thinner, which I take Plavix still. I've been on for 9 months. I have 3 more months to go, a baby aspirin the rest of my life, and as well a statin. So I said, wait a minute, I don't take anything. I barely, luckily you take a Tylenol. So my doctor said, no, you got to take the Plavix, okay? Because the Plavix with the stents, you could have a problem and you could have a clot and you can wind up having a heart attack and have some serious issues. So I said, all right, I'll take the Plavix, I'll take the baby aspirin. And I said to myself, doctor, I got to get back to running. I mean, can I run? He goes, we want you to run. Train, do what you can do. You never had a heart attack. You never, thank God, never had a stroke. You just had what we'll call a road-to-rotor job. We cleaned you out. We opened up the artery and you're good to go. So within 3 months, I went out and trained with a stent and ran a 1 hour and 39-minute half marathon in 3 months. I then continued and I started winning age groups and ran a 1:35 half marathon. And I was all ready to run the Boston Marathon. And you could see on my hand, my Boston Marathon band, which was last week. And all of a sudden, something happened to me on one of my last training runs. I had run a 10 miler in 1 hour and 11 minutes at just over 7-minute mile pace. And thought I was ready to run about a 3:15 marathon and just tear it up. I went out for a training run and I pulled my hamstring. And I have never had any injuries to my body. And that woke me up because I said to myself, why did this happen? I haven't done anything unusual. I mean, it could be a freak thing. But along the way, I started taking this drug, Repatha, because that's what we're talking about. And now we'll get to the Repatha. Because I couldn't deal with the statins. I was taking Crestor every other day. And it was just giving me muscle aches. And I said, you know what? I'm not taking this. My cholesterol was not that high, Joe. My first blood test before the stents, my cholesterol was 189 with an LDL of 125, triglycerides of, I think, 70, and my HDL about 60, 65, okay? And he says to me, well, that's a little high, above normal. Didn't think anything of it. So at that particular point, after obviously my stents were put in, he took another blood test. And on diet, I got it down to 90 LDL. No statins, just diet, eating really well and exercising. He said to me, we want you at 70. So I said, and I'm running great. I'm feeling good. I'm just having a good time, okay? And getting over the fact that, you know what, I got these drugs to take, and then Plavix is going to be over, but I'm getting my life back, I think. So he says, no, I want you low. So I go, all right. He goes, give me the shot of the Repatha. He says to me, no one seems to be complaining about muscle pain on this Repatha. So he gives me a shot, and I kind of felt funky that day. I said, I don't really feel weird. I kind of felt weird, but didn't think much of it. Went running, and nothing seemed to be that unusual. After the second shot, though, which was 3 weeks later, I waited an extra week. I kind of felt my body feeling a little strange because now I felt like the way to explain it was I had like no carbohydrates in me. I felt like I was depleted all the time. I was starting to get tired. I just felt off. My runs were not normal. Okay. And I said, something's wrong here. The third shot pretty much showed me, because that's when I had my injury. And after that, he gives me one last shot, which was 3 weeks ago. And then everything, all hell has broken loose, Joe, in the last 2 weeks. So what's going on with me now? I wake up every single day in pain and agony. My elbow, because I was taking the shots in the right elbow, I'm a lefty, in my deltoid, because I didn't want to do it in my stomach and I didn't want to take it in my thigh. I'm a lefty. I said, we'll do it in the right deltoid. After the first shot, something was wacky, but I didn't connect, because the deltoid on my elbow, I couldn't move. And I went to my orthopedist. She said to me, you play tennis? I mean, you're working out. I go, I play golf, but not anything to the point that it would cause this type of a pain. Gave me a cortisone shot, went away really quickly, the pain. And as you see, I just recently had another cortisone shot today because the pain is still there. My cholesterol, my doctor is thrilled to death. He goes, your LDLs are down to 59. Your regular cholesterol is 149 and your HDLs are 70. So I said, that might be great, but I feel like crap every day since 3 weeks ago. I have pains in all of my joints. I cannot get up out of bed for a good hour. Once I start moving around, it seems to kind of loosen up. My runs, I find I'm in agony. I could get through it, but I am in, like, I've never experienced this type of discomfort. And I know 100% it's to this drug. I looked at some of the side effects. Some of the side effects say bruising at the site of the injection. So I said, that's got to be what's going on there. Pulling muscles. Well, I asked you about that, Joe, and you don't know a history of that. But ironically, a close friend of mine who has much worse cholesterol than me and has been on statins for years, but he does not have a heart issue. He just has high cholesterol. His doctor said, why don't we try Repatha? He went out after his second shot, blew out his calf. He says, I don't know what's going on here. I said, Mike, welcome to the club. And he now has stopped the drug. I contacted the people at Repatha and I told them my story. And they said to me, well, we have a case number for you and we'll report this in. Thank you for letting us know. If you have any more information in the future, contact us. Bottom line is, this drug, Joe, is a poison. A poison. They took a healthy distance runner, top in the country for my age group, and basically, as of now, I feel like, at times, I feel like a cripple. I cry. I cry because I'm so sad, because I listened to the doctors. I listened because they told me this is a number. And then they told me, the Repatha people, on their testing, they tested 27,000 people, 13,000 with a placebo and 13,000 with Repatha. After 1 year of doing the test of the placebo and Repatha, the results came back. 10% of the placebo people had a myocardial infarction, a stroke, a heart attack, passed away. 8 or 9% of the Repatha people had the same. So wait a minute. You're telling me I'm injecting a chemical into my body that for 2% that I can roll the dice on? And the fact that I'm running every day and that there are other drugs out there, Joe, I feel like I got my cholesterol down. That's great. But my quality of life within a couple months of this drug has deteriorated to the point, as I asked you, Joe, I'm afraid it's going to be with me for the rest of my life. I've taken 4 shots, but yet I'm afraid I'm gonna live with this forever. You assured me that most likely it's going to clear itself out. The good news is this. Well, I don't know if it's good news, but it's bad and good. This drug has a half-life, people, of 17 days, which means that the injectable that I had, which is supposed to be bi-weekly, after 17 days, there's still 50% of that drug in my body. You go another 2 weeks, which is now up to a month, you lose another 50%, which means I still got 25% of the drug in my body. Take it down another 2 weeks, you're down to 12%. Lo and behold, we just keep cutting it in half. You're looking at anywhere between 2 to 3 months for this drug to clear my body. And after going through all of this and thinking about this, there's no doubt in my mind, this was overkill. Now, I talked to a couple other cardiologists prior to my present cardiologist about Repatha. And they said to me, Robert, you don't need Repatha. Repatha is a drug for very high cholesterol type people. You were going in there with a 90 cholesterol. Some people would never even consider taking anything with that number. But because my cardiologist said he wants me at 70, and I thought the statins were not the way to go, I said, I'll try this because this is supposed to be the miracle drug. No miracle. This drug is hell. So what do I decide to do, Joe? Ladies and gentlemen, I am detoxing. I can't wait for the 60 days to pass because I want this out of my body. Whatever it takes, I am going to take nothing. That as far as any kind of cholesterol medication. I told my doctor, he's not thrilled about it, but you know what? I'm not thrilled with him. And other cardiologists, as I told you, did tell me this is a little too strong for you. Okay, this has a place, I guess, for certain people that have super high cholesterol and are on statins, and they can't tolerate it. But I think taking an athlete, a high-level conditioned athlete, with a modest cholesterol, if I was not a cardiac patient with stents, I wouldn't be anything. We wouldn't be talking now because I went a lifetime with higher cholesterol. I had my bloods checked. I found some old blood work 5 years ago. My cholesterol, I think, was a 210. My LDL was at 125. I was better than that before my stents were put in. I was in the 180 range, 189, as I said. And the high number was the 125. But 125 LDLs is actually slightly above optimal normal. Okay, so I really wasn't that bad. And I thought I was doing okay, not even eating that great, just, exercising. So this to me, I'm so thankful to have found your website because I see now, after reading it, the stories. Sadly, I'm one of these people, but we got duped, ladies and gentlemen, in a drug, and this company is going about saying they got this great wonder drug, and the doctors and the cardiologists are saying they got the great wonder drug. I'm going to catch 22, Joe. I will never take Repatha ever again. There's no doubt on that. But I also, because I'm a stented patient, then they say, there's other variables with the stents. You need to take a Crestor type medication, which is, if I'm going to ever do any of them, that's the one I would take because that seems to be the best statin and the most gentlest. But what I will do, and I haven't decided yet, I'm going to wait and get a blood test in a few months and monitor myself to see if this thing creeps up. Because if it stays at a nice low number, I'm not taking anything. Okay, we'll just keep it the way it is. Okay, but the statins have the ability to decrease inflammation as well as remove the plaque in the heart. So there's kind of an advantage. It's not about just keeping your cholesterol low. It's about clearing out whatever other issues are going on in your arteries. So I'm really going to have to make some serious decisions, but I done some research on this. A lot of patients, some cardiologists say, just start with one Crestor a week. because that has a long half-life for a statin. It stays in your body 22 hours at half-life, which means it's probably in your body for about 3 to 4 days. So you can actually get away with 2 to 3 times a week, and you covered the whole week. Now, I'm not pretending as a cardiologist to tell patients to do that. Talk to your cardiologist. But there are plenty of people out there that are on statin therapy every other day because they can't tolerate it. It all depends, obviously, on the person. But with someone like myself, who is still going to run and exercise and have developed a cardio system, that I have peripheral arteries that are working for me. And that's the thing that upsets me out of all this, Joe, is that I never had any symptoms. And if I would have researched this a little better, I probably never would have gone for the stents. I probably would have tried to do it through diet, monitor, maybe then try the Crestor and try to eliminate some of the plaque. Because what that has done now is, sadly for me, I am now a cardiac patient for the rest of my life. I have to take drugs the rest of my life, even if it's a baby aspirin and a high blood pressure medication. Probably the high blood pressure medication is a good thing because my pressure was on the highest side, was running always around 140/90. Nothing crazy, but above normal. Okay, because I'm a high-strung kind of a guy. Now it's with the low dose. I'm taking a very low dose of a drug called Atacand or Candesartan, which happens to work really, really well for me. It's an angiotensin II receptor. I take 2 milligrams a day, next to nothing. Keeps my pressure under 120/80 on a regular basis. And if it creeps up, I'll just have to increase the dose. But that's a real low dose. And a baby aspirin, you know what? I probably should have been on that anyway. But the Plavix will end. The cholesterol medication, what we do down the line to be determined, seriously to be determined. But I got to really detox. And I just want to show you all a couple pictures because I want to show you what I was and how I feel now. This is a picture of me as a kid because the New York City Marathon's coming up. And the time, as you see, is 2 hours and 38 minutes. And there I am crossing the finish line in 1982, running 6-minute miles as a college kid. So I was running my whole life, okay? Then my last Boston, coming up Hereford Street. This race I ran 3 hours and 22 minutes at the age of 58. So they took an elite athlete and I got duped. And I'm so angry, Joe, and I'm so frustrated. And I'm scared. I'm upset. I'm in pain. And I'm not the same person. And you're talking about all because of a drug that I injected into my body 4 times. And the stories I'm reading are horrifying. I'm praying we all get well. But something has to be done, Joe. Something has to be done with this drug. They have to be made aware that there's a lot of side effects of this drug. It makes you feel crappy. I mean, I just feel like I never should have been on this because I didn't need it. I didn't need it. I didn't need it. I listened to a cardiologist who said, I want you at 70. A freaking number, people, a number. A number that, cholesterol's in the body for a reason, Joe. You know that. You're a physiologist. We need cholesterol. There's a purpose for cholesterol. I understand the LDLs. Does it really matter? 70 to 100? Is that going to give me it kind of cool? And what guarantees there if I get that LDL and keep it at 59 that I'm going to live a normal life anyway? So the quality of life, I should be in pain, miserable, unhappy, depressed, can't run, worried about pulling muscles for possibly saving my life for something that we don't even know. And I'm not even sure if this Repatha has been 100% approved for cardiac stent patients or people that have strokes or people. I mean, it's supposed to be, initially it was set up as an adjunct with statins as a secondary medication. It's such a new medication. The one thing going for the statins is they're old, Joe. They've been around since the 80s, and there's a lot of history with them. And there's good and bad, but nobody seems to really have the problems that I've heard. You could explain more about the rhabdomyosis, okay, with statins. I don't know what the future of what can happen with this, but I'm praying, and you've made me feel somewhat better. Today's a good day. I feel a little better today. Yesterday was a horrible day. I would think as the days go on, they're going to get better, but I have good and bad days. So,
you said
ladies and
something
gentlemen, that's
interesting
my
that you
story.
said.
So, if you have any questions or anything you want me to elaborate more on, please go ahead.
You said you felt better throughout the day than you did in the morning. That's similar to the person that I know who took Repatha a few years ago. In the mornings when I saw him, he was in a lot of pain. And he also told me as the day progressed, it seemed to get better, but it was still always there, but it wasn't as severe as it was in the morning. I'm curious, what did your cardiologist say when you told him you were having these bizarre symptoms like muscle aches?
Okay. Great question. I am so angry that I took this medication. He gave me 3 shots in his office, and they were not biweekly. I spread it. July 12th was the first. The second one was August 9th. The third one was September 9th, I believe. And the fourth one was 3 weeks ago. So whatever that is at the end of the month, I think, September 30th. Okay. Those are the 4. So I didn't even take it on a bi-weekly basis. I spread it out a little longer. He said to me, make an appointment. Come on in. We got to talk about it. I don't care what he says. I'm at the point now that, you know what? A lot of these cardiologists, they're told by the drug reps what these drugs are all about. And the drug reps are trained to sell a drug. And this drug is a very expensive medication, which I'm covered by. And that was one of the great things. I was covered by it. I thought I was getting a miracle drug. I was saying, I had my own plans. I said, you know what? I know you're supposed to take it every other week. I'll probably take it every 5 weeks. You know, because once I get down, I'll even if it creeps up a little bit, so what? I will never touch it again. I will never touch it again. And I'm not going to yell at my cardiologist because that's not my style. I'm just going to say, doctor, I'm never taking it again. I made a mistake. It's causing unbelievable discomfort for me. I have to detox. Let's talk in a few months where my bloods are at, and we'll make a decision going forward. But as far as this drug, no way.
Yeah, it's amazing, and I've spoken to other people who've had these similar symptoms. Again, the only person I know personally who's had, that's what sparked a lot of my interest in looking into this. And I've since heard from other people. I think I told you I did speak with a doctor a couple of years ago who was in so much agony he thought he was going to have to retire, and my heart breaks when I hear stuff like that. You know, and nobody should be in pain, and we're not throwing, you know, we're not casting aspersions on anybody. We're saying, you know, this is something that nobody is really talking about. And to my knowledge, I think I was the only one who started writing about it. And I read
you were the only one that I could find online, other than Repatha, the company.
Right.
But they didn't really didn't really have anything. They mentioned their general, and then I'm looking at all the side effects. And I'm saying, wait a minute. Right. Bruising, pain at the bruising injection site, flu-like symptoms, cold. I was having a runny nose. And I still get it a little bit now. It seems to be clearing up. I feel also internally, since I've taken these shots, like the chills in me. It's like a low-grade fever, but I don't have a fever. I can't explain it. I just feel off. Something, it's almost like it's like I have nothing in my body anymore. It's like cleansed everything out of me. You know, we need cholesterol, even if it's a small amount of cholesterol. And this drug, I mean, I remember I started with a 125 eating bad. And I got it down to 90 on diet. And they're still giving me drugs. I mean, it's the craziest. It's the craziest thing. So
You nailed
you
it.
know
You
what? I'm
said
going to roll the dice. I don't
you,
really. If I exercise and I do what I got to do,
yeah.
I mean, if there ever becomes a time, Joe, in my life that I can't run anymore, and my cholesterol, they worry about it, then I'll start taking maybe statins. We'll see.
You did nail it. You said they wanted you at 70 on an LDL, and you're not a number. And
Exactly.
I'm sure there's statistics out there, because I've seen the 70 number for LDL myself. I'm sure there's statistics out there that probably show LDL of 70, reduction in heart disease, whatever, or heart attacks, whatever percent. But you're an individual, you're not a number. And I think sometimes we get lost in the numbers. And you're a real athlete. You're here telling me, you're telling us you're running marathons in like 2 hours and some change. I remember many years ago being proud of myself of running 6 miles in 1 hour, and I never got beyond 6 miles.
You know what?
So
It's what I did.
yeah, and that's phenomenal. I mean, you're absolutely an elite marathoner. You're, in my opinion, you're in the top 1% of all athletes out there. And to be crippled basically from this medication is unconscionable. Your quality of life, it stunk when you got on this medication. And again, I'm not saying this because I'm trying to throw this drug company under the bus or anything like that. This is definitely something that nobody's talking about. And I don't know, and I think you're great for coming on the podcast and talking about this, because I don't know how many other people are out there who might have these symptoms. I'm hearing from these people, but maybe I'm only hearing from the people, because this is happening to them. There may be a lot more other people this is not happening to. However, it does appear to be a real phenomenon. And I'm glad you came on, because I really...
You are, Joe, you are a godsend. And hopefully the people will see this, people will Repatha, and it gets a lot of hits, and they contact you, because this, to me, you hit the nail on the head. Every individual has its story. And I'm not saying I'm better. I'm talking about Robert.
Right.
Robert's unhappy.
Right.
Robert was put in a situation, and now he has stents, and a cardiologist is telling me he wants me at a certain number. When some of these people are going to listen, I say, wait a minute, this guy was at 90 on diet, and he's taking other drugs, and was told to go on Repatha. They're going to say, what kind of cardiologist does he have? I'm beginning to wonder myself. But I do know that we are individuals, and this drug, you were the only one. And the stories I saw, I said, wait a minute, why is my arm bothering me? Why am I getting knee pain? Why am I getting hip pain, back pain, runny nose, just feel weak? I mean, I'm the type of person, let's go. Now I'm praying that this is going to be a memory that we could do a follow-up in 3 months from now. And we could say, you know what, Joe, my cholesterol is still great. I'm on diet. I am being careful. And you know what? I don't have any more aches and pains. Yeah. And I'm running the way I feel I should be running. And I'm back to somewhat of a normal life. But this drug, and everybody out there has their own situations. Right. But I think the fact that the whole point here is really on our podcast, Joe, is that, yes, it's about me because I'm telling you my story, but this drug is being advertised as a type of medication for people that are intolerant to statin because they're getting muscle aches. And it's a good compliant type drug because it's every other week or monthly is one of the ways you could take this. They make it sound, other than the price, but now it's coming down and a lot of insurance companies are paying for it.
About $1,000.
Wonderful. They're making it sound like we got the wonder drug and the drug of the future.
Right.
When, in my opinion, this might be one of the worst medications ever put, at least on a personal experience. This is probably the worst medication out there in medicine right now, because the statins that I was taking, yeah, I wasn't feeling great. Nothing like this. And they clear your body quick. those statins, and you've heard from other patients that if they don't like it, they stop it, they try another one. There's a lot of statins out there, and I'm not pro statin either, but I think if I'm going to have to go a certain route, I think I'm going to go with Crestor, because I think Crestor is the one that he likes. That's a very popular one, rovastatin, and it seems to be gentler on muscle aches. But again, we're not even near that. I want to get well first, don't have any muscle aches, and I won't even touch a statin, okay, till I see my numbers over 100. If it does creep up to over 100 and I can't keep it under 100, then I'm gonna have to have some. Maybe then I'll have to go once a week to kind of bring it down a little bit and avoid all the other issues. And that's what some of the cardiologists do recommend. Maybe not for stented patients. They really want guys like me on high dose because they feel like, and it's kind of sad, Joey, this is a thing. And I, as a physician, yes, but not a cardiologist, I still can't get the answer. I never had a heart attack, Joe. I never had angina. I never had anything. I came up with on a routine stress test, it showed a blockage. We're not denying the blockage, but ironically, my blockage was 70%. And that is the number that they are allowed to start at stenting you. If my blockage was at 60, no stent. And we wouldn't be talking right now because I never be on any medication, most likely. So, I'm basically, what I think to myself is, wait a minute, I don't have a blocked artery anymore. I basically have good cholesterol. I'm taking the baby aspirin. I'll finish my Plavix out because I have to take that to make sure I don't get any clots. Although by now, after 9 months, the second generation stents, which we're not going to go into, the patients I'm sure that are going to watch this have been stented. They only use second generation stents now. They take longer to heal, but the rate of for them to close up again or restenosis is very rare, and that's great. Yes. So I've pretty much gone through the 1 year. In fact, some cardiologists, they say they want you on Plavix the rest of your life and drop the aspirin. But you know what? I decided no way, because taking Plavix brings other issues. You get black and blue marks all over your body. I can't take aspirin. I can't take ibuprofen. The normal stuff, a Motrin or if I have a Excedrin for a headache, can't take that on Plavix. So, you know what? I'm going to trade the Plavix, keep exercising. And that's the one thing my cardiologist is good with. He goes, you know what? You're not a high-risk patient, meaning you are never had the heart attack, never had the stroke, never had angina. You're stable. You've been cleaned out. You could get off the Plavix. You're someone that will be able to get off the Plavix. So that's where we're at, buddy.
I think it's good. I like the natural approach. You may have encountered the Dean Ornish diet in your search for answers. Dean Ornish is I believe he's a cardiologist himself. He has published some research which has shown a regression of heart disease when you follow his protocol, which is essentially a really low-fat diet, daily exercise, which you're already really good at that, and also meditation. So if you just Google Dean Ornish or just go into PubMed and look for his data. I may even have his studies on my hard drive I can send you, but it takes a couple of years. But he has shown on clinical studies, on scans, a regression of plaque in blood vessels. So maybe that's something to take a look at if that's something you're interested in. But yeah, I mean, you can't go wrong eating a better diet. No doubt about it. Exercise is great, but it goes hand in hand with eating.
Well, here's the crazy thing. I'm not the best with fruits and vegetables, but I don't eat any. I don't eat any red meat. Okay. This is what I'm going to break down. I get sad. I'll tell you something. It's kind of a sad way to look at life, but I'll tell you a little bit about me. Number one, I've said a lot about me, but number one, never smoked a cigarette in my life. Good. I drink no alcohol. not because I'm an alcoholic. I just find it, I don't like the feeling of, getting drunk.
I'm with you.
Okay.
I don't either.
It just makes me feel like crap. I mean, I have drunk alcohol in my life, but I don't drink any alcohol. I'm not a beer drinker. I'm not a wine drinker. Nothing. Okay. I do drink some coffee to get me going in the morning. I've been doing that since college days. But here I am at 138 pounds, 5'9", not an ounce of fat on my body. I'm probably lighter now than I was showing that college picture in 1982 that I was in college. I probably weighed 145 back then. I was more muscular, but I was younger, but I also had no fat back then. Yet here I am. I'm the guy with the stents in his heart. I'm the guy that is the guy who's on here talking about Repatha, and it saddens me because there are other people out there who are not good with their diet. I don't eat any red meat, never have. Chicken, turkey, fish, a lot of salmon. We've cut out all the fried stuff. No, I have not had a slice of pizza in 9 months. I have nothing fried. No potato chips, nothing. No cakes. It sounds like, oh my God, this guy's not living his life. Well, you know what? This was my trade-off because I didn't want to go on statins and then Repatha. And in the end, shame on me. Shame on me. But finding you and your site, I've been woken up, and I will never, and it's not about ripping a drug company, because you want to know what? We might be onto something here. They might hate us, okay? But in the end, if we could save other people from what I'm going through, okay, and to be unhappy and miserable, okay, there are other drugs out there if you need to take drugs. And it's again statins. I don't want to take. The whole point was I don't want to take statins. I thought this was going to replace the statins, but you know what? Out of the two, I mean, there's no comparison.
Right.
I mean, any I don't want to even go into Zidia, which is another medication, which is not a statin, which I've never tried. But you're doing a service. You're really for people like us, and I'm sure there are plenty of people out there that are like me and have and you're such a kind man. I've read all your reviews, and after people cry and tell you their sob story, you're always so complimentary. I'm so sorry for you. I feel bad for you. How you, Joe, kind of came across going after Repatha is remarkable. Because
I appreciate you saying that. I never would have. It would never have been on my radar if I had not seen it myself in somebody that I know. And I told you about him. He's a very vibrant guy, and he had high cholesterol, high triglycerides, and his doctor also suggested doing the Repatha. And then so soon after that, the aches, the muscle aches, and I could see how much agony he was in. And it was only through sheer will that he was powering through it as he was.
That's what I'm going through now.
Yeah, he was working out with the pain. And again, a lesser person would not have been able to. And he's such an incredible guy. But again, when people write into me and they tell me that they're in pain, my heart breaks for them because I saw it personally. And I literally, within feet, I was within feet of this guy, and I saw him on a regular basis, and just so much pain. And I didn't know how to help him. And so when people write in, they tell me these stories. Again, it just brings me back to what I was seeing with this individual, who, again, for people who may be wondering, he is doing much better after a few months of getting off of Repatha. His muscle aches slowly started to get better. Like you said, it's got this really long half-life, so it didn't happen immediately. It took a little while. How much? Again, I really wasn't tracking it that closely, but my guess is within a couple months, he started to really bounce back from this, and he is off Repatha now. I believe he is on a statin. No muscle aches, no muscle aches at all right now. So he's fine, and he's back to working out basically every day. So he's doing.
So what I'd like to see happen, and I don't know if it's possible, but I'd love to see a follow up on. I mean, I'm definitely willing in a few months to come back and and give you, get that I'm over this hell and going forward in my life and doing well with this and over the pains. But I'd like to, some of the people who are having these issues that maybe will respond to this podcast and they'll say, "Oh my Lord, I have the same issues. Thank you for putting this on there." And it's a similar type of a thing. We can maybe get a registry of people who like myself been on Repatha X amount of time, and what their follow up has been.
Mm-hmm.
There might be people out there. I'm sure there are some people that take this drug and have no pain,
Right.
have no muscle aches.
I'm
I mean,
sure.
you only hear the bad stories, sadly.
Absolutely.
I'm not a complainer.
Right.
I'm someone who just goes about his life, and and one of the most, I could take a lot of pain, but this has been something that has set me back, and quickly. It was probably the third shot was leading up to it, but after the fourth shot, right now I'm definitely a different person. But I'm hoping in a few months. I'm 3 weeks out. I keep 21 days now of no Repatha. Still got a long way to go, but I wear on my hand here my Boston Marathon. This was supposed to, they gave this at the expo because I didn't get to run this year. This was how we got to the starting line. I'm not taking it off till April because my goal is I'm going to look at this every single day and remember the day that I never got to run the Boston Marathon. And I've run it numerous times because of Repatha. And I'm going to come back stronger and tougher than ever because I'm focused in. As long as these aches leave me, as long as I can recover, I'm going to do what's best for Robert now, as well as, and that also means what's best for me. I'm not going to be stupid, meaning if they really say if my cholesterol starts creeping up, you got to do something, it's in your best interest, then I'll have to make a decision. But Repatha, never, ever, ever, ever will I touch that drug again.
I'm glad you came on because I really wanted our conversation to move the needle forward. My hope is that researchers watch us or hear about this, decide to do their own investigations and find out just how common or uncommon these side effects you and other people are experiencing are occurring, because I don't know. I tried to find good data and I really couldn't. And I've only heard from people like yourself who've had these muscle aches and other strange symptoms. The injuries you reported, again, that's something I'm not sure what the mechanism behind that is either. But again, you bring up a good point. We need cholesterol. You need cholesterol to make testosterone, to make estrogen. It's in every cell of our body. That alone tells you you need cholesterol. And what happens when you lower it to such a low level?
Exactly.
Could something else happen downstream? Again, it makes sense that would occur, but again,
I want to share with you, and I think maybe a good way to wrap it up, because you brought up, because we could go forever with this. Is great stuff, and we maybe could do another one because on what we're talking about here. Because one of the signs about the injury, I never pull muscles. And now, I've had a couple injuries in my life, but nothing but pulling a hamstring. I mean, on a run. And it all happened after the third shot. And my friend had his second shot. He ripped his calf muscle. Here's what the mechanism, how it feels to me. Okay. And you're an exercise physiologist. You might understand it. The old theory back in the day of marathon running was that we'd go for a long run a week before you run your marathon, and you would deplete your body of all the carbohydrates. You'd suck it. You go out for a 15-mile run and just deplete your body. Go 3 days of protein and fat type diet, no carbohydrates. And you're training through this. So what happens is your body is so depleted that you're really running and exercising on fats and muscle deterioration. It's a dangerous time because they tell you got to drink a lot. There was an old diet called the Pritikin diet. If you remember, the Dr. Pritikin, who passed away, I think 100 years ago, but his diet was protein and fats, no carbohydrates. And that caused heart-related issues, believe it or not. It gave people arrhythmias if they stayed on a long period of time. My goal was to be on it for 3 days. After you're on it for 3 days, your body is craving carbohydrates. And then you eat carbohydrates for 3 days, and the carbs stick to your muscles. They just get sucked in like a magnet, so that when you get to that 20-mile mark or late in the race, you've got some extra leftover carbohydrates that are still hanging around to get you through. Now, there's a lot of different theories whether that works or not. Yeah. I believe for me it worked always. It got me through these races back in the 80s. Now maybe they don't really believe so much in that. But the point I'm making is running on that protein starved feeling that's what it feels like. I'm always in like that starved carbohydrate sensation, and that's why I'm probably pulling muscles, because I'm probably dehydrated because I'm exercising. My muscles are now craving water, and they're being beaten up. So it's almost like every run now is like double what I normally do, because this drug has just sucked everything out of my body. Does that make any sense to you? I mean, as a physiologist.
Yeah. I mean, you're describing what is commonly called, carbo loading or glycogen supercompensation. You cut your carbs, you start to make more of an enzyme called glycogen synthase, which again sucks in carbs like a magnet. There is some data, as you said, it's kind of iffy whether it actually helps in the real world, but there are studies out there that do seem to show that glycogen or carbo loading does actually help benefit you, because you load up on extra glycogen in your muscles, and you can power through a little bit longer. You got more gas in your gas tank, so to speak. So that makes sense. I get that. And the body is mostly made of water, and that also includes our connective tissues as well. So
right.
Yeah, so you're depleting your body of water. Could that actually reduce the tensile strength of the connective tissue? It's possible. I would imagine it's possible. I haven't looked at the data on that. I have not even.
I'd almost like to see a comparison. Why? I know it's a different pathway, but statins. People get muscle aches with the statins, and it's got to be. I understand it's a completely separate pathway. They work completely different.
Right.
But it seems to be very high numbers.
Right.
I don't care what they say. They say 5 to 10% of people that take a statin develop muscle aches. I think it's more than that. Anybody I've talked to seems to say over a period of time, maybe not right away.
Right.
But why then people always change it? Why are they go Lipitor, Crestor, Provocol? They go to all different types, and they want to see, which works. Because doctors know that some drugs are going to cause certain reactions, and I think this has been a great video, an educational video. I'm hoping if there's anybody, if you have any questions, you can reach out to Joe. I'll be more than happy to discuss it on a one-on-one level, and maybe going forward, we can help a lot of people out there. I even want to see some positive responses from people, because that's important too. It should only be negative.
Right.
It should be, hey, I'm on this drug 5 years. I don't have any aches.
Yeah, I want to hear from those people as well. I really do.
I think it's not about the bad issues, because if we start seeing the only people that are going to respond are negative, and I want to see some good ones. Because if there's no good ones, then what are we doing here?
Right.
Other than reducing cholesterol.
Right.
And maybe some people don't care. Maybe some people are just so happy to get their cholesterol from their LDLs from 200 down to 80 that they couldn't. Well, then that's good for them.
Yeah, there's more to heart disease than cholesterol. And I'm with you. I want to hear from the positive people who've taken Repatha as well. And I'm glad you came on the podcast because I really want to move that needle forward. I want to have more of a conversation on this. And hopefully other researchers do further studies on Repatha and other similar PCSK9 inhibitors. And that even includes the natural PCSK9 inhibitors, because they're out there as well. There are some dietary supplements that have that reputation. I want to see more data on that as well. I do want to bring you back in a little while after you have detoxed from Repatha to see how you are doing, say your exercise improving, and again, maybe even bring on other people who've tried Repatha and see what their experiences are as well. So I really appreciate you taking time and really talking about this, because I'm like you, I have not seen anybody else discussing muscle aches and pains with Repatha. Even the TV commercials that this was advertised on TV at one point, I paid attention to those commercials and I didn't remember seeing anything about aches and pains on those commercials. So
it's kind of funny because when you look at go right to their page, they got a nice long list, and I said, runny nose, flu-like symptoms. Who cares? That's right. No big deal. And then I said, back pain, muscle pain, knee pain. Stomach issues. I'm like, wait a minute. There's a lot of side effects here. This is not supposed to be it's a wonderful drug to drop the cholesterol, but you know what? Sadly, for Robert, I didn't need this. I was at 90. What am I taking here? What did I do? All right, I don't want to go. I'll get into another frenzy here. But Joe, thank you so much. We'll touch base.
Absolutely.
Let's shoot. Let's say we're now. Let's maybe the first of the year.
Perfect.
I will come back. We'll talk more about it. I'll tell you how my running's going. I'll tell you how my cholesterol is, and I'll get a couple blood tests in between. Perfect. And I'll have some input on what has happened to me post months of no injection therapy. Right. And I'm hoping probably I'm going to be fine. I didn't take it long enough. That there could be any real long-term side effects. 4 injections at 140 milligrams. It's, what are we talking here? 560 milligrams in my body, where they give 420 or 460, I think, or whatever, something on a monthly dose. Right. So I was almost like I took like a little more than 1 month's worth of medication.
I'm still confident you're going to report back and say you're fine and you're back to running marathons again, and you're no pains whatsoever, because that's what I've experienced with the other people I've known have taken this. So I think you're going to be fine.
And people out there, last thing, when you do respond, if you're like me, you tried it, you had some bad side effects, please let me know and let Joe know down the line. And for the other readers of this, hey, I got off it 3 months later. I feel fine. It finally kicked out of my body. I was on it for a year. I was on it for 6 months. I like you, it was miserable. I stopped. My cardiologist kicked me off it. And after detoxing, I'm all good now. And we're on another drug, or we're going diet, whatever it is. I'd love to hear a lot of people's personal stories, their responses. And I'm hoping we're going to find a lot of good answers out there, that because that'll also be very important for people that do stop. Correct. Knowing that down the line, like your friend, it does clear the system, and it has to get out. Listen, in 3 months it'll be gone. Right. Even if it's 4 months, whatever it is, it's going to be out of my body. And
I think that's great data to know. I think it'll help a lot of people. So people can, write in or leave a comment or something like that about how long they've taken it and how long, if they did have symptoms and side effects, how long it took to get better. I think that again is really great information. You're going to help move that needle forward to help, again, hopefully spark a better conversation on this, and do some other research and find out how common this really is. Even if it is low, it's not insignificant if it happens to you. So again, I really appreciate you taking the time out of your busy day to really talk to me about this.
Joe, my pleasure. And we'll touch base again.
Absolutely.
Everybody, best of luck to you. I hope you learned something, and chime in. Let Joe see that you're watching this, and add some positive comments, negative comments, whatever your story is. We all want to know, because we're all, if you've taken Repatha, we're all in this. We're all in the same boat. Right. and there's going to be some good stories, bad stories, horror stories, not so many horror stories, recovery stories, people who've dropped it like I have, and looking forward to reading some of the responses.
Yes.
Thank you very much again.
Thank you, Robert. Appreciate your time.